Hello, I'm Amanda Lee, and I'm part of our neonatal therapies team here in the NICU. I'm here to show you some infant massage techniques for your baby. Infant massage is so important for your baby. It strengthens digestion and circulation, which may lead to better weight gain and growth. It helps to achieve oral feeding and reduces symptoms of feeding intolerance, increases digestion and stooling, improves reflux, and may help to relieve colic. Infant massage may also decrease the length of your baby's stay in the hospital. Before you begin a massage, there's a few important things to remember. Your baby must be at least 31 weeks gestation in order to receive massage. Aquaphor or oil will be provided for your baby in the hospital. Once you're home, you may use an oil with a fruit or a vegetable base, but try to avoid strong scents or nut-based oils due to risk of allergy. Please allow at least 30 minutes for the massage. Some massages may not last that long. Generally, you'll only get to 1 to 3 body parts during that 30-minute time period. You won't complete the infant massage from start to finish. You'll get to a couple of body parts for one day, and then the next day you can do a couple of different body parts. Please check with your baby's nurse for an appropriate time to massage your baby. Often massaging before a feeding time is best. It is required that you watch this video before a neonatal therapist will come to your baby's bedside and schedule a hands-on massage instruction time for you to learn the techniques on your baby. You must wait at least 30 minutes after your baby has eaten before offering massage. This allows the stomach time to settle prior to baby's massage. Your baby's temperature must be at least 36.5 before the massage, and we ask that you not massage immunization sites within 48 hours of the immunization. We also ask that you do not massage over a fresh incision or surgical sites, swollen or bruised areas. Anything that looks like it might be painful for you to touch, we ask that you avoid that area on your baby. The most important part of the infant massage time with you and your baby is that it's an enjoyable experience for both of you. We want to be sure that you're able to read your baby's cues when your baby is letting you know that they're enjoying their infant massage. When your baby's face is neutral, their body is calm and still, and they seem relaxed, keep going with the massage. Your baby is telling you that this is an enjoyable experience for them. If your baby starts to give you a furrowed brow, or their face starts to look tense, if you see their muscles tighten or they're pulling away, if your baby starts to change in their physiologic status, we ask that you pause in containment or still touch hold to give your baby a chance to recover and rest before you continue. It may be that this is time for the massage to end for your baby this day, and you can try again tomorrow. Okay, let's get started with our infant massage. Before we begin the massage on your baby's legs and feet, we'll begin in a resting hands or still containment posture. We'll complete all of the strokes on one leg from start to finish before we move on to completing all the strokes on the opposite leg from start to finish. All right, we're going to start with legs and feet. We'll start each stroke in containment. The very first stroke for the legs is called Indian milking. So we're going to make a C shape with your thumb and your forefinger.
Go down on that. Yeah.
Thumb and forefinger.
Yep.
And we're going to start at the top of the thigh. We're going to make a turn and glide all the way down to the ankle. We'll do that stroke about 4 to 5 times. And stop after about 4 to 5 times so we don't overstimulate your baby. So this next stroke is called the turn and caress. Hands are still in a C shape. You're using your thumb and your forefinger. As baby gets older, you'll probably be able to use more of your hand. But for now, with your baby's tiny legs, we're going to just use thumb and forefinger. This one's turn and caress, so we're going to start at the top of the thigh, and we're going to do a hug of baby's thigh and glide all the way down. Start at the top of the thigh. We're going to do a hug and glide down to baby's ankle. Again, we'll do about 3 or 4 to 5 strokes so we don't overstimulate your baby. This next stroke is called fanning. We're going to start on the baby's foot. We're going to make a fanning motion from toes to heel, like you're smoothing out all the wrinkles on the bottom of your baby's foot. Okay, the next stroke, we're going to pinch and roll each little toe. So we'll start with the big toe and make our way down. If you know any sweet little nursery rhymes about the little puggies that went to market, this is your time to connect with your baby and share those little nursery rhymes. This is a time for you and your baby to enjoy together. So you're just going to pinch and roll each little toe. So the next one is a pressure point thumb walk. We're going to imagine 5 lines going from baby's heel to each toe. And we're going to walk our thumbs up on each imaginary line. Your baby's feet are so tiny you may not actually get 5 lines. But as your baby grows, you'll be able to get 5 lines from the heel to each toe. So this next stroke is the airplane runway. We're going to hold your baby's leg and we're going to use a flat hand to push off the bottom of baby's foot and take off like an airplane on the runway. If baby's eyes are open, we're going to wiggle our fingers really slowly from one side of their field of vision to the other, which is a nice stimulation for their baby's vision, crossing hemispheres from one side to the other. We can do that one a couple of times. If baby's eyes are closed, don't worry. We'll just glide off and do the airplane runway. Okay, the next stroke is the gentle stretching of baby's foot. It's a little hard to demonstrate on a doll because the dolly's feet don't really move back and forth. So if you imagine my hand as baby's foot, we're stretching back and forth gently 4 to 5 times. And we're gonna spend some time on the top of baby's foot and ankles. We'll be making small circles on the top of baby's foot, moving around to the ankles. We're just doing little small circles all around. Now we're going to move on to up milking. Again, we're going to use our thumb and forefinger. We're going to make a C shape at baby's ankle and glide all the way to the top to baby's thigh. Our very first milking stroke, we moved from thigh to ankle, away from the heart. Now we're moving back towards the heart, working on baby circulation in that direction. All right, the next stroke is rolling the leg. We're going to start at the top of baby's thigh, and we're going to roll the leg gently down to baby's ankle. We're going to take care to avoid the knee joint and ankle joint. And I like to think about rolling a snake out of Play-Doh when I make this massage stroke. The last two strokes, feather stroke and conditioned relaxation response, are strokes that you'll do once your baby has been discharged home and is a little bit older. For now, we'll end the legs and feet strokes in containment hold. Before we begin the strokes on your baby's arms and hands, we'll begin in still containment or resting hands posture, giving your baby time to prepare before we begin the massage. Then we'll complete all of the strokes, first on baby's one arm, and then moving on to complete all of the same strokes from start to finish on baby's opposite arm. The very first stroke listed in your packet is conditioned relaxation response. We'll do this one once your baby has been discharged home and is a little bit older. For now, we're going to start in baby's axilla or armpit area. We're going to use forefinger and middle finger to make little circles around baby's armpit. We're stimulating the lymph nodes in baby's armpit and the lymph system. All right, the next stroke that we're going to do is the downwards milking stroke. We're going to make a C shape with thumb and forefinger. Start at your baby's shoulder and glide down towards baby's wrist. A turn at the top of the shoulder and down. We'll do that about 4 to 5 times. It may seem like each stroke is a little bit quick, but we're really focusing on not overstimulating your baby by doing too many strokes. All right, hands are still in a C shape. Thumb and forefinger is what we're using for the turn and caress. We'll start at the shoulder, and we're going to make our way down to baby's wrist. Your pressure here is gentle but firm, moving from baby's shoulder down towards their wrist. Okay, the next stroke is palm of the hand. Our little dolly here, his hand is all clenched tight. So imagine hand is open, and we're going to do a fanning motion on the palm of your baby's hand. We're going to pinch and roll each finger. Just like we did with your baby's toes, we're just going to do a pinch and a roll of the thumb and each finger. Now we'll move on to the top of baby's hand and wrist. We're going to make small circles all along the top of your baby's hand and small circles all around their wrist. Now we'll do our upwards milking motion, again with the thumb and forefinger in the C shape. We'll make a little glide motion at the wrist and move upwards towards baby's shoulder. With the downwards milking stroke, we were moving circulation away from the heart. Now we're moving baby's circulation up towards their heart. This last stroke is a rolling of the baby's arm, just like we did with the leg, like we're making a snake out of Play-Doh. We start at the shoulder, make our way down toward the wrist. We're taking care to avoid any extra pressure on baby's elbow or wrist. And we'll end in containment hold. The last stroke listed in your packet for arms and hands is the feather stroke. That's one we'll save for you to do at home once your baby is a little bit older. For now, we'll end like this. Before we begin stomach, we're going to place our hands gently on baby's stomach in a resting hands pose. Before you do stomach strokes, we ask that you either start with your baby's legs and feet or start with baby's arms and hands and then begin stomach strokes, working our way outwards in so that baby has time to prepare for touch around their stomach area. The very first stomach stroke is hands under your baby's sacrum area, kind of just along the bottom of their diaper, and we're going to do a gentle rock back and forth, one side to the other. The next stroke for the stomach is a paddling downward. I want you to imagine your baby's stomach area is from the bottom of their ribs to the top of their diaper, this section here. And we're going to do a paddling downward stroke. One hand and then the other, going from the bottom of their ribs to the top of their diaper. The next stroke is the fulling stroke. We're going to draw horizontal lines, one underneath the next, starting at your baby's midline and moving outward towards their sides, from the bottom of the last rib down to the top of baby's diaper. The next stroke is the hands of a clock. When you're doing strokes on your baby's tummy, the direction you want to be moving is always clockwise. I think this stroke's a little tricky for sleep-deprived parents when you're adding in two hands. So if two hands is too tricky, you can just do a single clockwise motion on your baby's tummy. The next stroke is the I love you stroke. We're going to start by drawing the letter I on baby's left side. And then we're going to make an upside down letter L going across baby's stomach and downward. We're moving our way across the transverse colon, going towards the descending colon. And then we're going to make an upside down U along the ascending colon, transverse colon, descending colon. And this is to stimulate your baby's bowels. Hopefully it'll make them feel a little bit more comfortable. But sometimes babies don't like this stroke either, so you'll just have to get to know your baby and how your baby prefers. We'll do the rainbow's finger walking. We're making a rainbow along baby's stomach from one side towards the other. Again, your pressure here is gentle but firm, making a rainbow along your baby's tummy. The next stroke we'll do is the knee to tummy push. I'm going to take care to keep baby's hips close to the bed, not lift them too high up. Again, this is a good stimulation for baby's bowels, so look out, you might have a little surprise. We're going to start this last stroke by sliding one hand under baby's bottom, and then we'll put our top hand on the top. We're going to gently rock from side to side, one side to the other, and then we'll end the stomach strokes here in containment hold. Before we begin the chest strokes, we're going to begin in a containment or still touch hold. And then we'll move on to the hello stroke. So you'll put your hands together in the middle of baby's chest, and we're going to move our hands in an outward motion like we're smoothing down the pages of a hardcover book. Next, we'll do the Heart of Love stroke. Your hands will come together in the middle of your baby's chest, and you're going to draw a heart on top of your baby's chest. This last stroke for the chest is called the butterfly stroke. We're going to start at baby's rib cage and draw a diagonal line to the opposite shoulder, ending in a gentle squeeze. And then we'll take our opposite hand and make a diagonal line on the baby's opposite hip to shoulder, ending in a gentle squeeze. Diagonal line from hip to shoulder, alternating sides. And then we'll end the chest strokes with still touch. We'll start the strokes for your baby's face in a resting containment hold. And then we're going to bring our thumbs together at midline. We're going to draw lines outward along baby's forehead, moving slowly. One line underneath the next, over your baby's eyebrows. If their eyes are closed, you can gently glide your fingers over their eyes, over the bridge of their nose. All of these strokes are going outward. Once you get towards your baby's mouth, we're going to do opposite from what your packet says, and we'll be moving our strokes inward towards baby's mouth. We work so hard to get your babies ready for oral feeding by pursing their lips together for sucking at breast or bottle. But we want to be sure we're supporting that motion by bringing their lips together. Once we get past the lips, we'll go to baby's chin, and then we'll begin our outward strokes again along baby's jaw. Gentle little squeeze and circle on your baby's earlobes and all along the sides of their ears. We'll move to gentle little circles on the back of your baby's scalp and upwards towards the top of their head, taking care to avoid their soft spot, which is right in the middle of their head here. And again, we'll end with resting hands. We're going to begin the back strokes in still touch or containment hold. And then the very first stroke is the effleurage stroke. With the palms of the hands, you're going to move down the back from shoulders to baby's bottom. The next stroke is streaming alternately. We're going to move our hands in opposite directions, gliding down baby's back from shoulders to bottom. This next stroke is called sweeping the back. We're going to place one hand at baby's bottom and one hand on the shoulders. We're going to sweep our hand at baby's shoulders down the back to meet the other hand. And we'll do that stroke about 4 to 5 times. This next stroke is called circles along the spine. With the pads of your fingers, you're making circular strokes on each side of your baby's spine, from the neck down to their bottom. We'll take care to avoid putting pressure on top of your baby's spine. So we'll do our circular strokes on one side and then the other. This next stroke is called pétrissage. We're going to make large circles along either side of your baby's spine, moving from the neck down towards baby's bottom, taking care to avoid any extra pressure on top of baby's spine. Then we'll begin sweeping from head to toe. We'll make full sweep strokes from head to baby's toes. We're going to stretch out the legs and give your baby's feet a gentle squeeze. And then we'll begin that sweeping motion from baby's head all along their back and bottom, stretching out their legs. Gentle squeeze on the feet. And we'll do that one about 4 to 5 times. This last stroke for baby's back is called combing the back. You're going to gently vibrate and comb your fingers from back of the neck down to baby's bottom. Again, we're going to avoid putting any pressure along baby's spine. And we'll do this combing of the backstroke about 4 to 5 times before we end in a containment hold. Thanks for joining me today. One of our neonatal therapists will be stopping by your baby's bedside to connect with you to schedule a time to do hands-on infant massage instruction on your baby to learn side by side with one of our therapists. If you have any questions or concerns, please reach out to your nurse. Take good care.